Good morning. I'm Amy Smellers, Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. On behalf of MHA, welcome to today's Executive Insight Series episode. These one-on-one interviews continue to be a treat for all of us, and we're thrilled to be joined by another great leader from the world of Massachusetts healthcare today. A few logistics before we start. We will be recording the session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, please enter them into the chat feature. The questions will come directly to us, and we'll do our best to address as many as we can during our time together today. Following the webinar, we'll be sending out the recording along with a brief survey. I want to take a moment to thank our 2023 sponsors for their support in underwriting MHA's education programs. In particular, I'd like to thank today's program sponsor, Robinson & Cole. Robinson & Cole is an AM Law 200 law firm established more than 178 years ago with a deeply rooted culture of collaboration, civility, and inclusion. They serve clients and markets across the globe, and their Massachusetts team is a valued partner in fulfilling our mission at MHA. I will now hand it over to Kathleen Healy, partner at Robinson & Cole, to say a few words.
Thank you, Amy, and good morning, everyone. Robinson & Cole and Nathaniel Arden and I, who's with me, as well as our entire healthcare team, is delighted to sponsor the Executive Leadership Series, and in particular, the session this morning with Aimee Brewer. Amy, like many of us, returned to New England and is now the CEO of Sturdy Health, and we're excited to see the strong leadership that Aimee will be providing at Sturdy and its growth in the future. Thank you.
Thank you, Amy, and thank you, Kate. And thank you for your ongoing support and sponsorship of this series, and that all you're doing to support our providers throughout the Commonwealth in so many ways with you and your team at Robinson & Cole. We truly appreciate it. And thanks to all of you for joining us again this morning for a quick cup of coffee as we hear from another leader who is helping push forward our Commonwealth's world-class healthcare system. Over the years, our Executive Insight Series has been a valuable forum for people to hear directly from hospital CEOs about the state of the healthcare sector and the evolution of patient care. But they're just as valuable for what they teach us about the human side of leadership, especially in relation to their career journeys, mentorship experiences, and passions outside of patient care. And that brings us to today's guest, who checks all of those boxes and more. We're thrilled to be joined by Aimee Brewer, the president and CEO of Sturdy Health. Aimee is a New England native, but has traveled across the country during her time as a hospital leader. Most recently, she was the president of North Bay Healthcare Group in Fairfield, California. She made the trip back to the Northeast in October of 2021 when she was selected to take the helm at Sturdy Memorial Hospital, a full-service independent community hospital, which is now known as Sturdy Health. In addition to its flagship hospital in Attleboro, Sturdy also oversees a wide range of services at 26 locations throughout Southeast Massachusetts and Rhode Island. As I mentioned, Aimee joined the system at the peak of the COVID-19 pandemic, meaning she quickly became an integral part of the greater healthcare community here in the Commonwealth. We are also proud that she serves on our board of trustees and as a member of our CEO-level workforce task force, and as an everyday advocate for the needs of the Commonwealth's patients, caregivers, and communities. Aimee, it's great to see you, and thanks so much for being with us this morning.
Thanks for having me, Steve.
And to kick things off, you grew up here in New England, but you have traveled across the country throughout your career. So if you could, just kind of walk us through your journey and how you ended up back in the Commonwealth today.
Sure. Well, I was born and raised, as you mentioned, in a small town in New Hampshire, and I went to school. I went to college at Simmons College, now Simmons University, in Boston, and I was doing a pre-med track, and I switched to public health. I was so fortunate to start my career at Children's Hospital in Boston, and I partnered with extraordinary physicians, and one in particular who was truly a champion of patient-centered care and innovation. And from there, it took me to HCA, Hospital Corporation of America, very different. And I also, at this point, tell you, part of my background's a little different than maybe the majority of hospital and healthcare CEOs, in that I spent the first decade, 20 years of my career on the physician side and the medical group side, and really focusing on building physician networks and governance and dyad leadership. And I also think while I was working with hospitals and health systems and their strategy, I was also really focused on the whole continuum of care and really appreciating the outpatient side and the post-acute side and again, the physician side. So I joined HCA where I was for 10 years, and I was started in their capital division, Massachusetts and New Hampshire, and then moved or was promoted to their mountain division. So at that point, I covered 14 different markets in Utah, Idaho, Alaska, and Nevada. And certainly my time at HCA, I learned a lot about financial and operational discipline, but I also really started to appreciate different markets and how local healthcare really is, and how what worked at a large Sunrise hospital in Vegas, 800 plus beds, was so different than Salt Lake City, which was so different than rural Idaho or Alaska, and how you recruit and retain people and how you build out service lines and the needs of the communities are so very different. From there, it was really intentional for me to join North Bay Health in Northern California at that time, after 10 years with HCA, traveling a lot, doing a lot of development and growth, and transitioning to North Bay was a really intentional decision for me to join, to take all that sort of experience and knowledge and really focus on one community. It was a 2-hospital health system with a home health, hospice, very large medical group, ambulatory surgery center, and owned its own health plan, and functioning in a capitated market. And so I was able to really focus my expertise on one entity and really make an impact. And it was there that I really sort of developed a passion for independent health systems and community care. And 7 years later, we were managing a pandemic. In California, we were also managing annual wildfires and getting really good at, are we going to need to evacuate the hospital? Are we going to need to accept patients from evacuated hospitals? Are we going to have staff today? Can they drive through the fires? And so it was this really intense time of managing one crisis after another, and one crisis on top of another. And I'll also mention my entire family is still on the East Coast, and we really took for granted the ability to be able to fly back and forth and visit. And so I don't mean to shout out to Whit Kiefer, but when they called about this sturdy opportunity, it was really a perfect match to continue working and leading an independent health system, but do that a little bit closer to home. So here we are.
Here we are, and then it leads to the obvious. I want to get back to the wildfires and the crisis there, and I'll link it to your work here. But let's just go to the obvious question: the West Coast. So we are very parochial here in the Northeast, as you know. But what is different? How does healthcare here compare to healthcare there, and how did your experience there help ready you for what you're doing now?
Sure. I think there's a few differences. One, the payment model. So in California, or the market I was in, there was a very, very large capitated or risk-based model. So we were truly responsible and paid off of taking care of the entire patient. And so there was versus fee for service, where we're paid, every time we do a test or do an office visit or surgery or admit a patient. In California, you were paid for the patient's total care. And so there was such a huge focus on keeping patients well and keeping patients out of the hospital. I'll never forget one Friday night, I was rounding in one of our practices, and the doctor was talking to her nurse and like, make sure you call, Amy and Steve and Sarah, because it's going to be really hot this weekend. And I want to make sure they have what they need to not have to come to the ED. And so there was this huge focus on wellness and health and preventative care to keep people out of the hospital. You also built out urgent care, built out your ambulatory to again, really educate patients on where to go and why. I think the other piece, I was in Northern California, I was very close to Silicon Valley. And so there was tremendous partnership with startups and tech companies that was really exciting to be able to see, here's the ideas, here's how we can keep care at home, here's how we can early adopt and see, patients decompensating, or there was all of these different ability to partner and be beta sites with people very early on, which was really exciting. And then I think the third thing, again, is the continued sort of natural disasters, whether you're managing wildfires or whether you're managing power outages, planned power outages that lasted for days, which all of us know that is not ideal for a hospital. So I do, and of course, worried about earthquakes and civil unrest. And there was a lot of things that there was a time where we said, we're managing what many people have in their career in like 2 years. So it was certainly a good leadership exercise on crisis management.
Yeah, you were dealing with some of the things earlier on than the rest of the country, just in terms of load balancing by necessity on some of the other disasters you were facing in California. Did that help prepare you for what you found when you got here? I mean, you're one of only a couple of CEOs that literally started in the middle of the pandemic.
Mhm.
What were your first impressions at Sturdy, and how do you create priorities in those early days when you're dealing with
Sure.
all that's going on in the community?
Yeah. Well, first of all, it's always this balance of you want to take a lot of time to get to know the organization and the community. And certainly I did that. But at the same time, you enter mid-pandemic and there's significant burning platforms. So not first and foremost, how do you keep managing this crisis? And even, I started, and in that January, there was the next huge spike in COVID cases for Massachusetts and our community. And so how do you respond to those, again, crisis, and how do you keep your workforce safe and your community safe? So you always had to balance that. Sturdy had also implemented Cerner mid-pandemic, and not a great time to implement an EMR, but as many people on this call know, you can't just, it was delayed and it was delayed, but then, an EMR implementation is something that takes years to plan. Sturdy also unfortunately suffered or was the victim of a cyber event. And so there was multiple different sort of burning platforms that had to be managed at the same time you're trying to get to know the organization. And so I think my priorities on those early days were getting to know everybody and trying to understand how this community and organization, all the strengths and all the opportunities, while also diving right in and managing many of these challenges that existed and had to be resolved. It was pretty early on, though, that I realized as an organization, we need to work on a strategic plan of how are we going to recover? How are we going to move from pandemic and sort of crisis response to recovery to sustainability? And that's where we all kind of, work together to say, all right, here's our reality. And our reality is very similar to many health systems. And then we also have these other challenges. How are we going to move forward and continue to thrive for the next, 110 years?
So your 100-day plan goes up in smoke, right? Because there's really at that point, you're trying to survive the next 100 hours or 1 hour.
Right.
So how do those early priorities stand now that you've been there a few years and you're really making significant changes at Sturdy?
Mm-hmm. Well, I think a few things. One, I mentioned some of the sort of crises, right? I mean, we resolved our cyber attack and our class action lawsuit and can put that behind. We really built out an important infrastructure and really dedicated additional time, money, resources to getting our Cerner implementation to a place where it was usable. And is it perfect? No, but it is, I think, much better than it was. And that's something we continuously work on. We did embark on a very comprehensive strategic plan in those early days. So I started in October. In January or February, we delayed it from the surge. We started a system-wide strategic plan that really allowed our entire organization, our physicians were involved, our leaders, our board members, our community members, and we did a lot of data. Where are we? What is our current state from a market share perspective, from a quality and experience and financials? But also we did a huge feedback session where over 1,000 of our patients and community members could really help us develop the strategic plan to really say, where are we going? How do we get out of this together? How do we not go in 25 or 30 or 50 different directions, but really stay laser focused on our future? And so, that strategic plan, part of it is a continuous improvement. Part of it is expanding access to primary care. Part of it is developing our specialty care. Part of it is financial recovery. That's a huge piece for most health systems right now. And then the other big piece, which we can talk about if we have time, is part of it was the brand and telling our story. There was a big part where we kept hearing is there is deep loyalty to this organization. I hear on a daily, weekly basis, oh, I was born at Sturdy, my mom was born at Sturdy, and this deep loyalty and legacy. But there's also a lot of misconceptions about Sturdy. And I don't know if you want me to kind of talk about that, or I don't want to go.
Well, no, let's talk about it, but let's do it by connecting the dots. So you've seen West Coast, East Coast, you've seen different payment models. You've stabilized Sturdy, you've done a strategic plan, you've been a front row seat leader through a global pandemic. And now you've kind of uncovered some of the challenges for the future of independent care and specifically at Sturdy Health. So what does that look like and where do you go from here?
Sure. Well, I think a lot of things, there's two very overused terms that I think are very relevant. One is transformation and the other is financial recovery. I think it's really, how do we think about care differently? How do we think about transforming this organization? How do we think about our workforce differently? I mean, we've talked a lot about the overarching, healthcare. There's burnout, there's exhaustion, there's early retirements, there's people leaving direct patient care. And so how do we really focus on becoming an employer of choice, right? I mean, what are the things that we can do, whether it's different scheduling, whether it's making sure our staff can have much needed time off with their families or friends, career development opportunities, returning people to the workforce. I think one of the things I hear about a lot is, well, I wanted to work, but I can't do 12-hour days because, I'm a single parent or whatever. How do we adapt and allow people to work 6 hours? And I think for many of us, it's like, well, that's just a pain to schedule. I'd much rather have my 12 or 10 or 8-hour shifts. But I think the organizations that are going to be very successful really need to adapt to a changing workforce. We also need, our patients want different things. I think what I've seen is, first of all, there will always be an incredible role for academic medical centers as well as hospitals, but we need to really focus on keeping care local. And I think that's what Sturdy does is, we mentioned we have 26 primary care and specialty locations. One of the things that I noticed when I first joined Sturdy was but even with our name, there was this big misconception that we are a hospital, Sturdy Memorial Hospital. And in fact, over 311,000 patient visits occur outside of our hospital walls in our practices each year. And so how do we really build service lines and centers of excellence? How do we think about partnerships to keep care local? And so those are some of the things we've been working on. And then the other term go ahead.
No, go ahead. Yeah.
I was going to just say the other piece that, again, as a leader, we can't not talk about it is the financial recovery. I mean, we have to think about that in how we are reimbursed and our cost of supplies. I mean, everything is up. We joke, though it's not funny, from bacon to Band-Aids. We have seen inflation and the use of travelers and all of that has driven many health systems to a place where the financials, you don't really see it's, the wicked problem. I mean, we no longer see the methodology where it's like, oh, if we just pull this lever, it'll work out okay. That's where the transformation comes from. We've seen many health systems have to resort to closing service lines and things like that. And for Sturdy, it's, how do we keep those open and how do we grow them and how do we be successful? Because we're in Region 5, right, in Massachusetts, and Region 5 has continued to be hit with Norwood, closed, and Brockton closed, and Compass disruption, and all of these different things just continue to provide a demand for care on our health system. And how do we keep growing responsibly to meet those needs?
So, yeah, you went there. So I want to dig in because you have been literally on a day-to-day basis dealing with other people's crises, right? So Norwood has a flood, Brockton has a fire, and Compass closes overnight. What do you do? What does that do to your staff? And how do you absorb all of those folks, right? Because it's really 3 providers in an entire region that have had to deal with that response. How do you lead through that? And what do you say to your workers that are just showing up every day to keep doing it?
Yeah. Well, first of all, I think we say thank you to our workers. And number 2, we have a deeply dedicated group of physicians and clinicians and clinical staff, and the entire workforce here, I think, takes our responsibility as a healthcare provider very seriously. And so, I mean, we partner and try to, I think the most shocking one was, and I don't mean to, they were also dealing with a crisis, but the most shocking one was to see Compass close overnight and then on their website just like go to the ER and listing Sturdy. And that was the time where our ER was just, inundated with all the other sort of crises, as you mentioned. And so I was like, no, time out. Do not go to the ER, right? How do we provide the right level of care? And so here, go to urgent care or one of the ways we responded, I was very grateful, is our primary care, of which many are not accepting new patients, all agreed to take, 10 new patients. And so that allowed us to accommodate several hundred new patients overnight that were displaced. And so I think, again, it's just really continuing to see how can we meet the needs without tipping the system over. I'll give you another example. Just recently, Taunton was one of the towns that accepted hundreds of migrants from Haiti. And the hospital in Taunton doesn't have labor and delivery. And this cohort of patients or migrants, many of them were pregnant. And so again, overnight, we were asked by our FQHC partner to help us provide the maternity care for these patients. And so again, Sturdy, of course, responded, and our physicians said, and our labor and delivery and our women's health staff jumped right in and started taking phenomenal care of these patients who have been through a very traumatic experience, who have not had a lot of prenatal care. And, again, just jumped in without looking back and said, this is what we have to do for our ever-growing community. But it's tough. I mean, it's straining the system.
Yeah, we could talk about workforce a lot. And I just want to know you've been a leader in some of the ideas that you're talking about in terms of taking some of the rigidity out of the system and other unique things to attract people back to healthcare. But you're also a gem for the community. So you just say a word, and then I want to talk a little bit more about you and your leadership. But just say a word about what it means to the Attleboro area to have Sturdy and what's unique about being an independent community hospital.
Yeah. Well, I could talk about this all day, but I want to be mindful of time. I think one of the things is, again, you have care local. So our community doesn't have to drive to Boston, which again, certainly has some of the best healthcare in the world, but it can be 40 minutes or it could be 3 hours with traffic. It's, $40 to park. It's stressful. It's all of the things. And I think what Sturdy has is our physicians are trained at the top institutions in New England and across the country. And we've been able to recruit and bring together this incredible group of physicians. So our patients in this community are getting equivalent level of care in a very personalized way. And so I think the staff, the patients, the doctors, they know their patients, they know their families. They've had this relationship for many, many years. And I think that number one is a huge gem. I think our emergency department, when you have a heart attack or a stroke or a car accident or break your leg or whatever the things may be, it's nice to be able to be 10 minutes away from a really high quality health system. I also think our nimbleness, because we are small, decisions are made locally and we're able to respond, whether it's new technology or a new service line, or responding to a crisis. It's things that we're able to make decisions, right here in this suite very quickly. I think also for our staff, truly to be able to know your leadership, to know your physicians, and to really work together. It's not just sort of lip service. It's like we really are focused on continuous improvement and at the staff level every day.
So in terms of knowing your leaders, and you literally are in the neighborhood, right? Sturdy is in the middle of the neighborhood.
Mm-hmm.
You are accessible, you're available, you answer your phone, you're there for me, you're there for so many others. I know that mentorship has played a central role in your approach as a leader. And one of our best sessions, it was just such a joy to have you speak alongside Justine Zillikin at our women's conference last year, someone you've mentored. Can you just say a bit about the importance of mentorship and how people can get involved and give some time to those mentor relationships? Sure,
yeah, absolutely. I mean, first of all, I've been so fortunate to have incredible mentors, both formal and informal, my entire career. I mentioned starting my career at Children's Hospital. That physician, Dr. Lynn, if he's listening, I'm sure he's not, but I think about him constantly because he really taught me, not only with his words, but his actions, that if you do the right thing for patients, the rest will follow. And I've really found very few exceptions to that philosophy. And so I think that sticks with you at an early impressionable age, that your true north or your, decision point needs to be, how does this impact patient care at the end of the day? And so I think for me, having, again, been so fortunate to have this mentorship in my life, it's really made me think, how can I keep giving back? And for me, these mentors have been a sounding board, someone who can push back and say, gosh, you should think about that decision differently, or that career path. I think have also taught me so much. And so for me, I think people can get mentors in all different ways. I don't think it doesn't have to always be, the CEO of the company or whatever. I think you can also get a lot from peer mentors, and really just spending time getting to know different perspectives within healthcare and beyond. And I think it's also about putting yourself out there and saying, I would like to learn more about your journey. I would like to learn more. Do you have tips and tricks for me? Or I'm preparing for this really difficult meeting or conversation or interview or whatever it may be. Can I go over it with you? And so I think many organizations have formal mentorship programs where they see emerging leaders and they, pair you up with different senior leaders or physician leaders to provide formal mentorship. And I would say take advantage of that. Even if you don't think you're ready, or if it makes you step out of your comfort zone, do it anyway. But I would also say, keep being your own sort of advocate and seeking those. And, I mentioned one of my mentors in high school was a biology teacher. And when my first real job out of college was a physician at Children's Hospital, and one was, my boss, and one was a formal mentorship program. And so they come in different varieties. But I'll also say for me, I've also learned so much from colleagues, and just again, taking time to listen and to observe and to ask questions, I think would be, something I would provide.
And it sounds like mentorship to you is leadership, but we got a great question in the chat talking about your story and being a great story, but also what are some of the leadership skills that you're using to achieve these results, and what are the most important leadership skills that you've used?
Yeah, well, I think a few things. For me, it's a relentless focus on improvement, and that is for myself as well, continuously learning. And I would say, like, this is what I do, but also what I would sort of recommend for other people. Like, I always try to think about things from all the different angles, whether it's a decision or a problem, or how do I think about all the different angles? How do I think it from the CFO perspective, or the nursing executive, or the physician, or the nurse, or the patient? How do you have a very well-rounded view of the problem or the decision that good or bad, or big or small that you have? I think that's important. I think for me too, I also try to get multiple different perspectives. So I listen to a lot of podcasts, I read a lot, and it's not just like Harvard Business Review, although that's wonderful. It's also, Wired, and seeing what's happening in Silicon Valley and what technology is coming down the pike, and just really getting as many different perspectives in my head as I can. I think also communication, and this goes back to crisis management. This goes back to and I don't have it all figured out, but for me, communication is so important. How do we communicate the why? How do we communicate the vision? How do we communicate the decision all day, every day, in multiple different channels? It's having town halls, it's rounding. I get very antsy when I'm in my office for too long. So how do you get out and have one-on-one conversations, small group conversations, of course, written things like that. So I guess to summarize, communicate, and many different ways. I think listen and observe first. I think have a very well-rounded or try to have a very well-rounded perspective. My kids might disagree that I do that, but I try to look at all the different angles, of a decision. And I think just keep learning.
So we're coming to a close, and we've covered so much, and obviously these always leave us wanting more. But lightning round, you mentioned podcasts and books. What are you reading?
I just was on a flight and I picked up my my teenager summer reading book, and it was great. It was Trevor Noah's memoir of growing up in South Africa, Born a Crime. Great book. So just read that.
And do you have a restaurant for us in Attleboro?
Oh, I do. I have two. Briggs, and I know it's a pizza place, but it has some of the best salads I've ever had in my entire life. And then there's also this incredible Italian restaurant, Don and Gigi's. So if you're ever in the Attleboro area, I'd love to take you all out to Briggs.
And do you have any Netflix, Apple TV, any mindless activity to end the day?
Oh, Steve, what I watch on TV is pathetic because I don't watch it very often, but when I do, it's shameful. I'm obsessed. If you haven't watched it, Jury Duty was hysterical. And I also am a little bit late to the game, but I just watched the Smartless podcast, like 6 series video. And it was also, you can see I need the mindless. things. It was hysterical. So
Smartless is hysterical. It's a great.
yes. Yeah.
Aimee, thank you. This has been a real treat. And the pursuit and evolution of learning is really exciting. The mentorship, what you're doing in Attleboro, it's really remarkable, and what you're doing on behalf of MHA and all of our members. So our morning cup of coffee is coming to a close. I just want to thank you again for being here, for your tremendous leadership on behalf of our healthcare system and its patients. You're a guiding light for Southeastern Massachusetts in what has been a few dark years. It will continue to lean on you for your guidance as we write together the next chapter of healthcare. To our audience, if you enjoyed this morning's program, MHA hosts educational content every week like this all year. We're especially excited about our in-person event taking place next week in our Burlington office, where experts across the state will do a deep dive into our healthcare system's most pressing priority, and you heard a little bit more about it this morning, its workforce. This will be MHA's second annual Workforce Summit, and if last year's event was any indication, attendees will walk away with some new ideas on how to support, retain, and grow our talented pool of caregivers who make our hospitals and health systems run every day for our communities and for our patients. Thanks for spending your morning with us, and thanks for all you do on behalf of the Commonwealth's patients, caregivers, and communities. We look forward to seeing you at our next Executive Insight session. Stay tuned for details to follow. Aimee, thanks so much for your time this morning.
Thank you,
Look forward to
Steve.
working with you more in the future.
Thank you.
Have a great morning.